We are the Center for Advancing Health Outcomes, research that transforms care, policy, practice, lives. Visit us at advancinghealth.ca.
Welcome, everyone. Thanks for coming to this presentation. I'm very pleased to introduce Dr. Johanna Sam, who's generously volunteered to give this talk. Dr. Sam is a proud citizen of the Silkwotans, so those who might know it by the other name of Chilcotin Nation, which is located up near Williams Lake, BC, and currently lives and works on the traditional lands of the Musqueam people at the University of British Columbia, where she is a Michael Smith Foundation Health Research Scholar and Assistant Professor in UBC's Faculty of Education in the Department of Educational and Counseling Psychology and Special Education, as well as NITEP, which is the Indigenous Teacher Education Program. Dr. Sam currently leads the Yatu Lab, which is rooted in the seasons of life focused on childhood to early adulthood. And her training is in developmental and educational psychology and involves using a public health approach to develop upstream and downstream wellness supports. She is particularly interested in the use of Indigenous knowledges to promote holistic wellness among children and adolescents, especially in the digital world. So with that introduction, I'll pass it over to Johanna and just welcome you to our series of talks here at Advancing Health.
Yes, good morning or good afternoon, everyone. It is now lunch hour. Let me get myself set up here. So today I will be presenting on bridging worlds, knowledges and design thinking for digital adolescent mental health assessment in digital spaces. My name is Dr. Johanna Sam Setsira, Salakotin Haya, Set Musqueam Nansida As, Sian Quil Boozy Eva Sam Ananli, Siaba Boozy Francistic Joe Ananli. And what you see pictured here is actually the river in which I'm from. So Salakotin Nation literally translates to people of the river, and that is the river in my homelands near Williams Lake. So if you're not sure where that is situated, I thought I would kind of help us. So we're down here in Vancouver. If you were to take the Fraser River about 800 to 900 kilometers north, you would be in my home territories. So what brought us here today was really thinking about public health perspectives in digital spaces. I think what drew us here is really all of us being aware of the importance of e-mental health screening that can be a universal approach to well-being of our young people and protecting our children and youth. It's an effective upstream public health approach, which often leads to better health outcomes and recovery and mental health promotions. Having said that, we need to situate ourselves and really think deeply about social determinants of health. One thing I'd like to propose today is looking at colonization and colonialism as an actual social determinant of health. Myself, I'm an intergenerational survivor of Indian residential school. I am the first generation in my family that was not forced into an Indian residential school. In 2022, our number at the St. Joseph's Indian residential school was 93. Since last year, through more testing, our number is now at 159 possible unmarked graves, and only 4% of the entire school property has been searched now. So think about how many remains may be still remaining in the 96% that has not been searched. I also want to acknowledge that this number is even lower given some of the atrocities that were happening at the St. Joseph's Mission Residential School. For instance, there's survivor stories of young children who have passed away and their bodies were placed in the creek or the lake for their remains to never be found, and also stories of babies being in incinerated in the basements of the Indian residential schools. The pictures that you see there are the ones that I've actually taken myself on the two kind of on the left-hand side when I went and visited the school grounds. And what you see pictured is the small piece of property that's been searched so far. I also want to acknowledge that the school was closed in 1981, so I barely missed it by a few years of having to be forced to go here. Part of my work really thinks about how we approach research and the study designs that we're using in research. So I want to introduce a term called two-eyed seeing. This term is from Mi'kmaq. It's actually an East Coast term. It's not actually a part of my own Selekotine teachings, but something that I've been drawn to. Elder Albert Marshall has proposed this idea of two-eyed seeing, where in one eye we see Western ways of knowledge systems, a way of doing. So in that sense, our traditional sense of how we approach research, so hypothesis testing, data collection, analysis, models and theories. Whereas on the Indigenous sides of ways of seeing, we look at respect, relationship building, reciprocity. What am I giving back with this research? How are we doing things in a ceremonial way? Having repetition, will these results be repeated somehow? And my responsibility as a researcher to carry these stories and to carry this work forward. So the study aims of this project were really, what are the collective experiences of Indigenous youth accessing integrated primary health care for mental health, and what were their preferences for digital mental health tools? I did this through looking at respectfully building relationships with Indigenous peoples and communities using a strength-based methodologies approach, which really centers on holistic wellness, holistic ways of being and doing, looking at storytelling, oral traditions, and the purpose of oral traditions, really focusing in on experiential learning, experiential ways of doing things in our research as a form of learning, and also respecting and taking into consideration the colonial histories of our past. The settings of the study were done in collaboration with what was formerly known as the Inner City Youth Program, which is now Foundry BC. Foundry BC had a pre-existing relationship with the Urban Native Youth Association here in Vancouver, located on East Vancouver. Foundry is an integrated primary care delivery model, meaning that it's a one-stop shop for youth. Youth can go into Foundry and access a wide range of services from mental health care, substance use services, physical and sexual health care, youth and family support, social services, while staying in their home communities. So we worked in collaboration with Anya to help us with the study design, as well as to promote the study. We had on-site posters, we made announcements through their email listservs with youth. We also had social media ads on their Facebook pages. And what we did was recruit youth for some time to join us in person. And we invited them to Anya. We had food available. We hired a caterer to create a warm and safe space for young people, as well provide them something to eat. In total, we had 8 participants. Of that 8, 3 of them identified as young men, 4 of them identified as young women. All of them identified as First Nations. About half of them had graduated from high school, and 3 of them had higher than high school education. Majority of them identified as heterosexual. Most lived independently on their own. Half of them had lived in the Lower Mainland Vancouver area for more than 10 years. And half of them did identify as having a regular family physician. So this table is a little bit messy, so let me kind of break it down for us of study procedures. So when we invited youth in, we held 2 half-day sessions with our young people in person. And what we did was in the morning, we introduced ourselves, our research team. We had a high energy icebreaker activity. We introduced a mobile app that was a mental health screener app to the young people. So we brought an iPad so the youth can interact with the mental health screener. We also did an activity, a participatory activity, where participants co-created persona stories. And I'll get into that a little bit more in a second of what an actual persona story is. We provided lunch break with them. We also asked them about their user preferences for the mental health screening app, which I'll share with us on what they told us. We asked the youth how comfortable they felt with finding health information online. Most of them said that they knew how to find helpful health resources online. They knew how to find health answers to their health questions online. But what this is interestingly telling us when we asked them was they actually didn't feel confident in using the information that they found online to make health decisions. Many of the youth reported how they found out if they trusted this information they found online. A lot of them indicated that they felt websites belonging to health organizations, hospitals, and government to be the most trustworthy places to find information. None of them talked about looking at pages or online resources that belong to people they relate to. So they really were going to health organizations, hospitals, government websites, in regards to looking into their health and well-being. So when we brought our young people together, we asked them, we presented an empathy map. An empathy map is a way to guide young people in creating a story. And so they make up a fake person, and we ask them to give this fake person a name, an age, a gender, ask them what their interests are, some of their likes and dislikes. We ask the youth, what does this person see and hear? What do they say? What do they do? And how are they feeling and thinking when they do this? And so the youth talk with each other in small groups. They come up with a person story. The reason why we do it in this way is really to give youth an opportunity to share about themselves without disclosing personal information or personal details about themselves. They can talk about personal experiences in a way that is, oh, a youth may experience this, or a youth may experience another may experience racism. And so they're able to talk about these experiences without outing themselves or outing others that they may know. And so what we do with the empathy mapping is we displayed it on flip chart papers. We also had handouts available and we brought felt markers and sticky notes for them to get really creative and hands-on with this exercise. And what we do is after they're done creating the empathy map, we take what they say and actually create a bit of a case study from that. And so I'll read this out to us because it is a bit long. So McLovin is a 25-year-old male. He's an organ donor. He's in college studying. He exercises by playing disc golf and beach volleyball. He walks to a liquor convenience store. Sometimes he's happy, but other times he's sad. There's racism around him. He hears others saying, "Why do you get free healthcare when others don't?" He feels judged because some people assume that all Indigenous people are the same. He tries to eat healthy food to maintain his health. He might speak up to ask for help. He says, "I have what it takes to survive." Another persona story that was created by our young people during these sessions shared with us. Sage is an 18-year-old young woman who has grown up on her reservation with her First Nations community. She likes to be involved in her culture. She has a cultural identity. However, she is scared to go to the clinic and doctors because her family has told her scary stories. Sage has been having sex. She is worried she has a sexually transmitted infection, but does not want to go to the doctors. She is scared about what will happen and what they will do at the clinic. And then our last persona story, this one is quite a full one, so I will read it through it for us. Donald Duck is a 17-year-old male. He enjoys PE classes. His least favorite classes are English and math. He enjoys being physically active, especially running, hiking. He also likes Indigenous dancing. He enjoys listening to music. When Donald Duck gets sick, he waits until it gets really bad before he gets help. He feels it hard to get help from doctors, so if it's not a big enough problem, he will not go into a clinic. Donald will wait for the sickness to get worse. For example, a cold leads to a flu and turns into an infection. Donald may miss school from being sick. While at home, he will stay connected with friends and family on social media like Facebook. He feels happy to be online since he has something to do. He gets advice on Facebook from his friends about what is making him sick. He may search Google for his symptoms. He finally decides to go into a walk-in clinic. He gets medications such as antibiotics. He does not get better. He goes to the hospital because the doctors are better at the hospital. The hospital is a safe place that has food and a bed. He feels nervous yet happy at the hospital. He's happy to get help, but nervous about what will happen. He's also happy to be at the hospital because he does not want to get his other family members sick. Donald is able to get all of the help he needs at the hospital because it has everything from tests to medication. He does not have to go to a pharmacy to get his medication when leaving the hospital. Donald gets better. He's able to go back to the community to enjoy dancing. He enjoys dancing because he can teach younger generations. He also serves elders first at communities, and he stays connected. So as you can see, these stories are really rich in what young people are sharing, and you can tell by these stories that they're drawing on their lived experiences and developing these stories. So outside of these stories, we asked them about what was some of their user design preferences with looking at digital tools. And we gave them pens and crayons and felt markers. And what they did was draw some things. So it was not only the look and this aspect was about the look and feel of mental health screening tools, and some of the look and feel that they wanted were more based on Indigenous ways of knowing. So in the top picture here, we have sweetgrass. We have a smudge bowl with a Métis sign in the middle of it. We have two hands holding the bowl. And then on the bottom picture is the tree of life. It represents empathy, honesty, kindness, and it's welcoming. And what the young people were sharing was medicine is healing. It should be hands-on and welcoming, and also involve our traditional medicines like sweetgrass and sage and smudge. They also talked about traditional and storytelling, creation stories. How do we bring in creation stories into the healthcare system and respect them in a way that helps our young people? And so what they talked about was a raven carrying a medicine wheel in its mouth. So I, as a Selekot team person, am very familiar with raven stories. Raven is a part of my culture and my way of being. And if you're not familiar with Raven's story, the story is Raven had flown into the sky, and he stole the sun and brought the sun down to Earth so all of us on Earth could have sunlight. Raven also decided to make half the time daylight and half the time night. And so this is a creation story on how the earth was made. And what the young people shared was drawing on this creation story, but bringing the medicine wheel into it as well. So the medicine wheel talks about holistic wellness. It talks about a balance between our mental, spiritual, emotional, and physical wellness. They talked about user design preferences as well, and looking at key words or key teachings that they would like to see. They talked about honesty, having healthcare professionals be honest, having healthcare professionals show kindness, respecting them. They talked about the teachings of sweetgrass and how there's 7 strands of the sweetgrass that are intertwined with each other as we braid them, and how we bring in these 7 teachings into our healthcare systems. So 7 teachings could include respect, kindness, leadership, sacredness. They also talked about locally here about the heron and how that represents honesty. When talking about wellness, they talked about the importance of balance between all aspects of ourselves. Again, when talking about knowledge, they mentioned bringing in characters that they're familiar with in creation story, like Raven. When they spoke about health, they recognized that health has both a negative and a positive aspect to it. So there's a balance between it, and there's a discovery of benefits and consequences. So there's a consequence in regards to some of my behaviors or actions, and they're aware of that. So some of the takeaways from this is really looking at racism and shame about mental health and sexual health are seen in the persona stories. And this is one of the reasons why Indigenous youth are reluctant to seek healthcare. In one of the persona stories, in McLovin's persona story, there was racism in the sense that all Indigenous people get free healthcare, which is a stereotype myth. That is not true. Indigenous people do not get free healthcare. And so breaking down some of those myths and stereotypes and why that person may be reluctant to see a healthcare professional. So the stereotypes that we may have of Indigenous people, and how we interact with youth, they talked about that. They talked about the barriers that they faced in these, what they viewed as discriminatory systems. They viewed healthcare as being a place of discrimination, including healthcare professionals were reported in the persona stories. For instance, youth viewed healthcare professionals as someone being scary, someone who isn't looked at as being trustworthy. So how do we break down these barriers in helping our young people, really examining our own healthcare systems and looking at a systematic approach and recognizing the embedded racism within our healthcare systems, and how some of those embedded racisms prevent our young people from accessing healthcare. We also saw the reluctance of Indigenous youth in seeking healthcare in the persona story of Sage. She was a young woman who was interested in sexual health, but didn't want to go and see a healthcare professional because of the stories that she heard. And then finally, in the last story with Donald, we saw that Indigenous youth are self-reporting that they will not see a healthcare professional until the problem, their concerns, health concerns, has really gone into an infection where they really can't avoid healthcare anymore. So they wait until the problem is so bad that they need to see an ER doctor. And so how do we prevent them from waiting? Like, how do we stop them from waiting that long? How do we get them through the doors into our clinics sooner so that when they are just facing a cold or a small minor infection, that we're able to provide healthcare before it gets worse? So a two-eyed seeing approach in design thinking and Indigenous storytelling can help create culturally revitalizing digital mental health screening tools. What I want to mention here is really the methodologies and the research and how we're approaching our research when working with Indigenous youth. Looking at bringing in Indigenous storytelling approaches and utilizing that in our methodologies. For instance, having young people, instead of doing one-on-one interviews with them or a focus group session where I'm just asking them questions, I really thought about how can we create stories? How do we bring our voices and our stories into research spaces? And one way of doing that was through the empathy mapping activity with our young people. It was structured enough where we were able to guide the conversations with our young people, that our participants that were there, and helping them design the story, asking them probing questions as they were designing that story to really get a sense of their experiences accessing healthcare, while still drawing on our westernized approaches that we may be familiar with. Other ways that we approach this in really working with Indigenous communities and organizations. Through this project, I actually had a research memorandum of understanding signed with Anya, in that all of the data, if they wanted to, they were able to access that data. They had kind of co-ownership of those interviewed transcripts, or in this case, the persona stories. So really thinking of, even before engaging into this research, how are we building relationships with the communities in which we're working with? And how are we building partnerships? Moving beyond just collaboration and consultation, but actually having a full partnership with Indigenous peoples and communities, and doing that in a good way through research MOUs, and establishing how are we going to control this data? What are we going to do with this afterwards? Making sure that organizations are aware with our intentions of how we might want to publish, how we might want to engage in knowledge mobilization and translation, either be conferencing or like this, webinars, making sure our organizations are aware of our intentions with the use of this data and how we might be engaging others in community. So advancing e-mental health screening tools represents an important element of public mental health, and it's likely a growing demand for culturally safe e-mental health apps. Other things I've been working on is I've been taking this idea even outside of mental health screening tools, but thinking about even data collection. How are we doing study designs? How are we developing our online surveys? Are they look and feel from a culturally safe place? One of the things that was raised about the e-mental health app, outside of the look and feel of just incorporating imagery or teachings, was even the way the questions were being asked. In this particular screening tool, some of the substance use questions were, when was the last time you drank? When was the last time you smoked? And what the young people participants said was, there's already an assumption that I'm drinking. There's already an assumption that I'm using substances because it's asking me for the last time I engaged. And what some of the young people said is, I've never drank ever in my life. And this is already assuming I have. And so how do we approach even asking questions on these e-mental health apps that are trauma informed, coming from a place of care and strength based, instead of assuming that they've used substances in the past? Assume that they haven't and start from there. And that's what our young people had mentioned to us through the study, was really looking at strengths of themselves and really honing in on some of those strengths. Moving forward with this research, based on this, what I found from this, I've actually shown some of my survey items and questionnaires to elders and knowledge keepers in Selekotine Nation to ask them for feedback. And they have given me ideas and suggestions on some of the items that could be changed or altered that may be more culturally safe. So not only am I now thinking about the look and feel of the study design, but I'm also thinking about the types of questions that I'm asking, and looking at our survey items and sharing that with community and sharing that with an elder and sitting down with that elder and going through item by item by item, how we're asking questions to our young people and getting that feedback. So really moving away again from just consultation to giving the community, hey, heads up, I'm doing research, to now I'm sitting down, sitting with an elder, working on survey design items, even before I meet with the youth. So the elder is aware as I'm building my research and study that they're involved in it right from the beginning. I also want to share some of the resources. So this is if you want to go back and look at some of what I shared, it is available through online. It's been published research. I actually went through this quite quickly because I feel like the best part of my work is actually talking with people. So I'm going to stop sharing there. And I actually want to open it up for conversations and questions that we may have. If there was anything that stood out to you through the persona stories or questions you may have about the study design, really just having a conversation, which is, I think, a different approach than a traditional webinar where I'm a speaking head. I always say it's popcorn design too. So popcorn is you just pop up once you have a question. Feel free to turn on your cameras, your mic, or even type them into chat. I really want to hear what you're thinking after hearing some of this. Oh, hey, Foundry.
Maybe I'll jump in with a quick comment here. I'm so proud of Johanna and great to see her just making all this happen. But I just like to highlight for everyone that the transferability of this process, that you could use this for all sorts of things. And maybe Johanna can comment about it, but as an approach, and this is what really struck me, of bringing in storytelling, the respect for culture, and it provided sort of a central point to start a discussion. It's not like, what are we going to do? It just was a great way to talk about things, to build a sense of trust and respect, and and really get a really meaningful conversation going about an important topic, and not just have blank faces and teenagers just nodding with everything you say because they think you know because you're a researcher or whatever. So I'd really like to highlight that. And I'd like to comment on or ask Joanna, like, have you thought about applying this approach of sort of this tool of building these sort of using these personas and the affinity mapping to really get a lot of detail there, and applying that approach to any other aspects of your research involving youth, like any other tools or e-interventions or healthcare interventions? Because it's a great way, at least from what I saw, to really get people talking about important topics, but in a safe and respectful way.
Yeah, I've used empathy mapping in my cyber aggression research. So majority of my research now looks at cyberbullying or online aggression. basically how kids are being mean online. And part of that work was working with the Métis Nation. And this, if you give me a second, I will pull up. What I've done is I've digitalized my empathy mapping, and I will share with you an actual empathy map that I've done with our young people. So let me share screen. So this is an empathy map that I've done with Métis youth, looking at, let me zoom in, looking at cyber aggression. And so what I did was I displayed the empathy mapping. Miro is a free, publicly available site. There's a user subscription with it as well. I use the free one. And what I do is had youth tell me about what they're experiencing online. So again, like how Chris was saying, it's just a way to start conversations. They give this person a name, Sarah, age. In this case, they gave them pronouns. They were questioning their ethnicity. We asked them more about their family to kind of describe who their family might be, where they live, their likes and dislikes. And then in this case, how does Sarah spend time online? How has she experienced someone being mean? I've drawn on how are they a warrior? Instead of asking young people, how are you coping with this or how are you dealing with this? Because I'm working with, in this case, I was working with Indigenous and Black youth, and the story or ideology of warrior, like warring up and your strengths, really stood out as more of a way for them to engage. Ask them what they see online, what they say online, what do they do online, what do they hear, what do they think, and what do they feel. And this was just one way of bringing that into a digital space. And so I've used this outside of mental health access to looking at how young people are engaging online. And I've done this with as young as grade 3. So grade 3 is like 8 or 9-year-olds. And 8 or 9-year-olds, they're so cute. They're just, they say things in their way. They're like, when something mean is happening to me online, I'm going to talk to my mommy about it. Or they get called crybaby and they'll go to their room and cry alone. So these are types of things that through adapting empathy mapping, you can adapt it to different ages as well. Yeah. Cool. And I see some questions. I think one of the questions is, was there anything that really surprised you during the storytelling process, something you didn't expect? I think what surprised me was actually they brought up creation stories on their own. They brought up their own traditional teachings from their own nations. And so oftentimes what I share with researchers and educators and scholars is localize, 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 localize. I'll say it again, localize, meaning work with the nations in your surrounding community. I'm Selekotine, living on Musqueam territory. The history behind our two nations is my nation went to war with Musqueam. I'm very much an uninvited guest in this territory. And I've been told these stories as I've been engaging with Musqueam and building relationships. They're like, oh, you're from the Chalcote Nation. Let me tell you about this war story. And that's common. My nation has gone to war with a lot of nations across BC. So any community I go into, I humbly go into because I'm expecting a war story. So now I tell people for every war, there must be peace. And so as much warring as we done, we had to actually go out and make peace with all these nations as well. And so I come in humbly as an uninvited guest. And really drawing in on our nation's knowledge keepers, our nation's stories, and recognizing where their stories are coming from, and avoiding the pan-Indigenous approach, avoiding saying Indigenous people, but really honing in saying, hey, that's a Chalcone scholar, that's a Musqueam scholar, that's a Cree scholar, and really drawing in on our nationhood. Another question here. I'm curious about how we ask about sources of strength that are based on relationships, elders, aunties, knowledge keepers, friends, and family, building on your trauma and resiliency, a formed approach. Yeah, so for instance, when I was doing the empathy map with the Métis youth, when I asked them how do they act as warriors, they themselves talked about, I talk to my aunties, I talk to my elders. They will bring it up as a source of coping strategies themselves. And so what I do is I just hone in on that and I say, oh, expand on that. Is there anywhere else that you look for support? And what young people are sharing is when they go online, they're looking for Indigenous advocates. So social justice, land protectors, and following some of their feeds online. So for as much negative that's happening in their lives, they're really seeking out for themselves sources of strength. And so drawing in on those strengths. One way that I do it is I speak about my own personal experiences as well, helping youth because I have those lived experiences. So what I would say is inviting knowledge keepers into that space. One way that I've changed my approach since this study is actually having an elder or knowledge keeper present at every session. So what I've done, say, with the cyber aggression research is I brought in a Métis knowledge keeper who was identified by the Métis Nation of Youth. So it's not someone I chose, but someone the community chose and put forward. And I invited that elder into that space. I introduced myself, I introduced the study and went over consent. I asked, in this case, it was on video, on Zoom. I asked if I could record. And then I gave the youth the opportunity to leave on their camera, keep their camera off, audio, chat. I told the youth they can engage in any way that they like and share what they wanted or not share what they wanted. And I had the elder open. The elder opened up with a story. In another case, I had a different sharing circle with an elder. That elder opened up with prayer and a smudge. So I really let the elder drive how they want to open. And then I also asked the elder to close the circle at the end of the session. So they may close with an ending prayer or some words that was shared with us. So really looking at bringing elders into those spaces or knowledge keepers into those spaces. Again, if I don't have those relationships and I don't know who a knowledge keeper is in that territory, I will ask the tribal nation, I will ask the band, I'll ask an education coordinator that works with the community to nominate some individuals for me and share some contact information. Right, and so the question I have in chat is a question that I have is how do you take the empathy mapping findings and translate this knowledge for service providers? Or how do you present findings also honoring the two-eyed seeing? So how I've done that is really looking at creating these what I call case studies. So for instance, with the persona empathy mapping, what I've done is created those stories. I've written them up with a research assistant and creating an actual story with them. I share that story back out with youth to make sure I captured their points properly and correctly. And then I take that story to organizations or to teachers. And because I work in Department of Educational and Counseling Psychology, I teach in the teacher education program. So I'm fortunate enough to teach teachers, which is really a fun job, really great group to work with. And so I'll bring these as case studies for them. And I'll tell teachers, this is created by youth. This isn't something I created, but this is youth voices. And so when I do the empathy mapping, I'm honing in on this is in youth voices in what they're sharing, their lived experiences. Yeah, so one of the pieces I have here is talking about quantitative data and how it doesn't necessarily create ways of strength-based knowledge for practice of change. I would say my work is very mixed methods. I do both qualitative and quantitative, and that's because I work in community. So when I go into community, I hear two sides of the coin. I want numbers. Show me your numbers. Show me your modeling. I want to know what the masses are saying. And then some people are on the other side. I don't even want to see those numbers. People manipulate stats, they manipulate numbers. I want to hear what the people are saying. And what I say is you need both. You really do need both. Because when I do my work, I will present a online survey, a demographic survey with some survey items like I showed you. And I had e-health literacy questionnaire items. And through e-health questionnaire, I was able to take a quantitative assessment and looking at where do youth look for information online. Through that, I found out they're looking on websites, healthcare websites, hospital websites. And also through that, I was able to determine how trustworthy this information was to them. They're saying, I trust things that are on government or healthcare websites. I don't trust a blog from someone I know who's just ranting. So I feel like both are needed. Even in my cyber aggression research, I do both. I will do quantitative assessments of their cyber aggression and then do an empathy mapping. And one of my latest projects, I was able to determine through quantitative assessment that my participants all reached kind of the threshold for being cyber aggressors or cyber bullies. And when I did the empathy mapping activity with them, it was from a cyber victim's perspective. They viewed themselves as being a victim online from cyber aggression. So you really do need both to get a full story. If I didn't have the quantitative assessment to show that they were actually engaging in cyber aggressive behaviors, I would have just saw the story where they were the cyber victim. And so that having both pieces of information gave me a little bit more depth and complexity of what they're experiencing. So a question from a clinical data manager wondering if there's much uptake from researchers and others who are interested in working with Indigenous data and including courses such as fundamentals of OCAP offered by First Nations governance centers in their continuing education. I'd say there's a couple of questions in there. So OCAP relates to Indigenous data sovereignty. That is a big can of worms, I will say. I work grassroots with clinical community on trying to look at data sovereignty. And what I'm finding is there's different types of data sovereignty. There's research data, which is our interviews or in our surveys. There's administrative data that we're collecting at our health clinics, our student records. There's governmental data that they have. So all of this data systems are not linked or owned by First Nations people. They're linked and owned to us as institutions, and that's an issue. So for instance, I will look at, say, UBC. We have a memorandum of understanding with the Selekoti Nation. And from my understanding, there's about 23 researchers or ongoing projects within the Selekoti Nation. Who are those people? Where's that data going? What are we doing with that information? It's not being set with the nation right now. It's owned and looked after by UBC. So how do we transfer the power of data stewardship to Indigenous peoples? How do we create independent research institutes or centers that are arm's length from universities and healthcare systems? The only place I've seen that done so far is with the Maori people in New Zealand. So we're working closely with them on how we actually implement and do data sovereignty. I would say when it comes to data sovereignty, what is being shared theoretically is not what's happening on the ground in community. On the ground in community, it's very disjointed. Lots of individual research contracts, MOUs being established, but no cohesive approach at this point. So in regards to the second part of that question about uptake in courses, I feel that education is still really needed. And I feel like these types of webinars are still really needed to actually just share how to do research from an Indigenous way of doing things and how to take a strength-based approach first.
I'll just jump in and add, I was just teaching this weekend for the MHA from UBC-SPPH, and we include content on OCAP and data ownership, and we have the video that we show. I think it's from the First Nations Information Government Center with all the different things. And it's great that we're showing that, including that, but I think we don't go to implementation. So I'm just throwing that out there that we need to move beyond just making people aware and having recommendations and shifting to strategies for implementing how you might work with ownership, with the principles of OCAP on the ground as a frontline clinician. I'll just pass that little suggestion on based on last weekend's experience.
Yeah, I have to agree. The implementation piece. So things that I've been working with Clean & Co community is actually creating our own server systems. How do we create our own server system? We're also looking at possibly applying for grants to create infrastructure. Our dream right now is to create a research center in the style of a pit house with solar panels. Like, how amazing would it be for me to go back home to a pit house with solar panels and do all the research that I do? I mean, that's the dream right now. And so working with community. The other piece about Indigenous data sovereignty I'll touch on is building community capacity. So one thing that was really shared with me from Selacotin Chief Joe Alphonse was training our community, making sure that I'm training people who live and work in our community. So we're quite proud. We have the first all Clean & Co research team members. So in that, the lead researcher, primary investigator with them. And in my team, I have a NITEP alumni who is a language teacher of 20 plus years, working in the schools from K to 12. She still works out at Clean & Co school. I also have the land coordinator or land protection coordinator, who also has a dual hat of being on the Clean & Co Band Council. So not only is he a land protection manager, he also is in leadership and also a fluent Ninquani Chi speaker. We have an elder Angie Stump, who is the part of the Selacotin National Government's Women's Council. She's a Clean & Co matriarch, an elder. We also had invited a Clean & Co youth into that space to give us a youth perspective. Myself, and we also had a land protector, adult educator involved. So I share that this is an intergenerational team from elders to youth and adults. We have 3 fluent speakers and 3 of us who are on our learning journeys, our language learning journeys. And one of the proud moments was actually taking my research methods and having it entirely translated into language. There is no word for knowledge mobilization in my language. So that was an interesting practice, and just finding common terminology between English and language. Even healing circles. How do you translate healing circles into Ninquani Chik? And so that was a good practice for myself, because sometimes we were talking apples and oranges when I was saying, I'm going to do knowledge mobilization. What does that mean in community? And really thinking knowledge mobilization in community is not through webinars. Knowledge mobilization in community was me going out into community, into the meadow, and realizing my city car will not make it, having to park it and jump into my uncle's truck so then I could drive over to the place I needed to be and not break down or bottom out my car, and sit down for a moose feast, sing ceremonial songs with my family, and then have them ask me questions about my research. We also went out on the wagon trail. Selacotin Nation does a wagon trail from cleaning code to the Williams Lake Stampede. We talked about our research there. We also do a nation gathering on the land by the river once a year in the summer. We had our research team set up there as well. So we had a table and some posters, and people would just come up to us and ask us, hey, I heard you went down to Arizona for this research project. What was that about? Oh, I heard you asking questions about the wildfire and wellness. What's that about? What do you do at UBC? Making ourselves available in community, and that's mobilization, not through a community presentation, but actually being on the ground with others. And just a comment about how we're moving into full partnerships with communities, and it's really moving beyond collaboration and consultation. But yeah, very, very much working with our community. With the Cleaning Co research team, I meet with them weekly through Zoom meetings. So they're all located in Williams Lake or out at Anaheim, and I'm the only urban member, I would say. And so I meet with them every week on Zoom, and they really honed in on how those weekly meetings are moving projects forward and really helping us move our research agenda forward. And now we're meeting with other Indigenous researchers in the territory. We've also collaborated with the Maori scholars to look at how they're working on data sovereignty and personhood of some of their river systems. And then shared with us in chat was a link to more series of workshops for us. So those of you who are interested in that, there's a link in there for extra resources.
Oh, that wasn't, I was saying that was just the Maori Data Sovereignty Network, but I think we could have a whole series of workshops with you, Joanna.
Yes.
Based on Julie's question around how the Maori are engaging in like more of a bigger strategic cohesive way of doing data governance in a different way. So we're looking to you to do workshops. Sorry, you don't have to.
No worries. I think that what the Maori are doing is incredible, but I've also realized there's some things that are in play that make it for them in order to do this, move this work more quickly forward than Canada. So in New Zealand, the Maori, it's one language and one Maori people. In BC, we have nearly 198 distinct First Nations peoples here. We are the most diverse province in all of, I think, second most diverse province in all of Canada. The only other province that's more diverse than BC is Ontario, and that's just landmass, basically. And so when we are, as researchers working in BC, we're in a really different situation than the rest of Canada. We do not have treaties set up. When I was shared with elders, the reason we in BC do not have treaties was because the government of Canada thought we would all be dead from smallpox and Spanish flu, and that they would have killed us off. And there's research, at least in my community, that has shown that this was strategically done. Smallpox was strategically put into our communities through the government of Canada, through the Hudson's Bay Company, and that it was actually a form of cultural genocide. And so in my own nation, about 90% of my population was wiped out. And that is why we started the Chilcotin War. And it was a way to protect our people. And through the Chilcotin War, we were viewed as outlaws. Our chiefs were hung illegally in New Westminster. And since then, what our chiefs has done is gotten our chiefs exonerated. So the Prime Minister of Canada and the provincial government here in BC have exonerated our chiefs from the war chiefs from the Chilcotin War. That happened in 2018. So from the Chilcotin War in the 1800s to 2018, we just got finally exonerated. So these are ongoing things that are still affecting us today. And in my own nation, we're really looking forward to celebrating our 10-year anniversary of having Aboriginal rights and title. We are the only nation in Canada that has been granted Aboriginal rights and title of our land. Having said that, land is different than water. We do not have rights and title of our water. The government of Canada views those as separate. And also stipulations that I'm learning about this is water rights. The government of Canada has granted us 50% of our water rights. What does that mean? Does that mean I own 50% of the lake? Do I own one of every 2 streams? Like, what does that mean? It sounds good in writing, but when we talk about climate change and impact on climate and wellness, especially the buzzwords around land-based healing or land wellness, if your land is not healthy, your population is not healthy. One thing I worked with in my own nation is talking with young people. We had the 2017 wildfires in my territory. It wiped out everything in our backyard. So what my cousins and youth are telling me is what used to be bright green meadows and vibrant colors are now dark, black, dead. And what they're saying is that it's impacting their mental wellness. They now feel depressed. They're seeing the dead wildfires, the dead trees, and that's how they said they feel inside. There's no access, traditional access to berry picking. They have to travel further out to go hunting, and our salmon populations are at risk. And so when we talk about land-based wellness, we really have to acknowledge climate change in that as well.
Well,
I wanted to ask a question about the workshops, Joanna. You're welcome to brainstorm about the workshops with me, because I'm always interested in how do we engage, especially the youth in these communities who are wanting to become scholars. This has been as the trainee program and development coordinator that I took on 2 years ago in this role. It's a question that's been sitting with me. And it's a question that it gets posed when I'm trying to interact with sponsors and funding, because it seems they're in need of addressing this question too. They're really trying to get at that question: how do we fund individuals that we want them to get into that work in a scholarly environment? So I love the idea of the 2I seeing and that kind of concept, but that concept around scholars from the community. So, if you had any ideas on that, I'd love to have a one-on-one with you and get some information, because you really represent that, actually.
Yeah, I feel like when working with youth, Indigenous youth, the best approach has been through the intergenerational team. So when I first started, I was all gung-ho. I was like, I'm going to recruit some youth and get this research going and have some youth researchers in community. And I did just that. I recruited 2 youth and I was working with them, and I faced a lot of barriers. It was difficult to engage with them. They were missing meetings. They got sick. Some had deaths in community. And so it was a really struggle. And then I was like, this isn't working. And so I approached the intergenerational team, and I had the elders and adults, and I told them, I was like, I do mostly youth research. Can we bring a youth onto this research team? And they said, sure, if you know a youth, go find a youth. And I said, yeah, I do know a youth. And so I Facebook messaged a youth, basically, because they don't email anymore. So I DM'd a youth and I said, hey, I'm on this research team with this elder, and here's who else is on there. Would you be willing to be a part of this? That's when I got youth engagement. I saw the difference from just having a pure youth team to having an intergenerational team. So the elders and youth learn from each other. One example is on gender. So we were talking about gender and sexual orientation, and we were doing CHR training on it through I think they have some online courses, and we were doing those together as a team. And the elders start talking about residential schools and how gender was used as a punishment. So boys were put into girls' dresses, and girls had their hairs cut to look like a boy. And so they talked about the punitive or punishment around gender, and how some elders felt uncomfortable around that. And the youth brought in the perspectives of two-spirit, being bisexual, having openness and gender identity. And so we had, at first felt like an uncomfortable conversation between youth and elder, but I started sharing with them, both perspectives are valid. We need to understand both. And I said, as elder, you need to hear what the youth is saying, and as youth, you need to hear what this elder is saying. And so that was one way we came together as a team. And I don't think that conversation would have happened unless it was an intergenerational team. And so that just built on what we already do in community, having youth look up to elders. Like I said, it was a way better approach for my research team than having just an all youth research team where I really struggled with engagement.
And I think it really underpins why, just reaching out from an academic environment in terms of, where people are in their level of scholarship doesn't necessarily bring in those scholars. I think that you've hit on something there. And I think that intergenerational community involvement is really key in terms of recruiting those people into the research process. And it's a really interesting observation. Thank you so much.
Yeah, I would say the other strength of our team is the language and being able to have 3 fluent speakers through the whole process. Because us as younger generations, we're not fluent speakers, and so having that there and learning as we go. And like I said, I mentioned, the academic pieces, but we even have fun. Like when I took the research team down to Arizona, we're meeting with the Navajo people, and they, in their language, to say smile, they say sun. And we all start laughing. And they're like, why are you guys laughing? And we said that word translates in our language to poop. So what they were saying was smile, and we were all like, you're just saying poop. And so we just had a bust laughing. And so having language speakers really opened us up and in a new way, a different way that I haven't seen traditional research in that sense.
Well, that's great. I'm not sure if I'm supposed to be the one pointing to the time. I guess people who needed to leave left. But I don't know if there are any more questions here, but I'd really just thank you so much, Johanna, for coming and sharing your research and just the richness of both everything you've shared. And also, I think you've left us with a great example of a process in which it's very doable by us, even if we start with a simple approach of what we can relate to as a method of personas and affinity mapping. It's a starting point that might merge and morph into something else once we explore our partnerships. But I think it's a way forward to at least start a discussion and build a trusting relationship with Indigenous partners in this work. So I think that's great. So thank you so much for sharing everything.
Thank you all, Sachanya.
So if that's it, I guess we will say goodbye. And then Joanna's contact info and bio are all there. She's out at UBC. So try not to. I hope you don't get overwhelmed with requests as usual, Joanna. Take care, everyone.
Take care.